Hello, my name is Ace Beam. I am a board-certified cardiovascular nurse practitioner. I am in the Doctor of Nursing Practice program at Jacksonville State University. The title of this PowerPoint is Heart Attack Prevention Program, a Secondary Prevention Strategy for Patients with Coronary Artery Disease. This is a DNP-led project. Objectives include a description of the problem and patient population, discussion of risk factors, population needs, plan for program implementation, secondary prevention, heart attack symptoms, DNP leadership competencies, program evaluation, overview, and references. Coronary artery disease and heart attack. Coronary artery disease is a huge problem in healthcare today. Coronary artery disease is a leading cause of mortality in the United States. In patients who have had a heart attack, secondary prevention strategies lead to decreased mortality, reduced subsequent cardiac events, and increased quality of life. The highest priority in preventative cardiology is to patients with established coronary artery disease, as these are the patients most at risk of having cardiac events. Secondary prevention strategies following a diagnosis of coronary artery disease and heart attack is multifactorial. Programs geared towards secondary prevention should include risk factor modification, diet plans, exercise, as well as adherence to medical therapies. Coronary disease and heart attack defined. Coronary artery disease is the buildup of plaque in the walls of the arteries that supply blood to the heart. The plaque is made of lipids and inflammatory cells. The arteries may become narrow to the point of total occlusion over time. Oftentimes, heart attack is the first sign of coronary artery disease, and unfortunately, many patients do not survive their first heart attack. Coronary artery disease and heart attack defined. A heart attack occurs when blood flow to the heart muscle is blocked. The blockage is most often caused by a plaque made up of cholesterol, fat, and other substances. Risk factors for coronary artery disease include diabetes mellitus, hypertension, smoking, hyperlipidemia, obesity, family history of premature heart disease. Typically, we're referring to first-degree family members being parents, siblings, or children who are diagnosed with coronary artery disease around age 50 or younger. Psychosocial stress may play a factor in the development of coronary artery disease. Population needs. The target population for this program is located in a rural community on northwest Alabama. Unfortunately, historically, this population has had poor access to cardiology care. Plan for program implementation. The heart attack prevention program will be based at the local hospital. Information about the program will be available on the hospital website. Flyers will be posted to advertise the program. Local providers will be encouraged to refer patients to the program to gain information. Plan for program implementation. The DNP will serve as a team leader in this project and will focus on coordination and see that processes throughout the program are being maintained appropriately. A registered dietitian will be of assistance. A nurse practitioner will evaluate medical therapies as patients participate in the program to ensure they are on guideline-directed medical therapies to prevent heart attack. Clinic nurses will check vital signs, reconcile medication lists, and assist with telephone follow-up. The heart attack prevention program will be geared towards secondary prevention strategies for patients with known coronary artery disease. However, patients without documented coronary artery disease will also be welcome to participate in the program, as they will be able to find information to help decrease their risk of developing coronary artery disease. Secondary prevention strategies. Strategies to prevent heart attack in patients with documented coronary artery disease should be multifactorial. Lifestyle changes are most often necessary, and frequently, these are some of the hardest changes for patients to make. Heart healthy diet, low sodium, low fat. Patients should increase their physical activity. Patients should strive to achieve a healthy weight. Smoking cessation is monumental. The medications to prevent coronary artery disease cannot overcome the devastating effects that smoking has on this disease process. So quitting smoking is associated with a substantial reduction in risk of all-cause mortality among patients with coronary artery disease. Invasive therapies, including percutaneous transluminal coronary artery intervention or stenting and coronary artery bypass procedures, are also secondary prevention strategies. Strategies include medical therapies. Patients should be on statin medications. They should be on antiplatelets. Oftentimes, patients require nitrates, beta blockers, calcium channel blockers, and anti-anginal medications such as ranazoline. Heart attack symptoms. Program participants will be informed of the signs and symptoms of heart attack. Unfortunately, even in today's information age, many people do not understand the symptoms that heart attacks may present. Symptoms might include chest pain or discomfort, which is some of the most common symptoms. Feeling weak, lightheaded, or faint. Patients may have pain or discomfort in the neck, the jaw, or the back. Pain or discomfort in arms or shoulders. Frequently, heart attack symptoms include shortness of breath. Patients will be informed to call 911 if they are experiencing any of these symptoms. DNP leadership competencies. DNP Essential 8, Advanced Nursing Practice, goals of improving patient outcomes, delivery of evidence-based care. The DNP will conduct a comprehensive needs assessment of this patient population, and the DNP will serve as leader and mentor to team members. Additional DNP leadership competencies will include Essential 6, interprofessional collaboration for improving patient and population health outcomes. The Institute of Medicine support team-based care. The DNP takes on leadership role in development of the program. Furthermore, DNP Essential 7, clinical prevention and population health for improving population's health is supported throughout this DNP project and this heart attack prevention program by promoting health promotion, promoting risk reduction, improving the health of individuals and communities. So how will the heart attack prevention program be evaluated? First of all, program participation will be considered. How many patients actually participate in the program? Do program participants seem to retain the knowledge that is shared with them during the program? Do participants return regularly for meetings and for updates? Is the program having positive effects on the participants? Can participants effectively identify heart attack symptoms? Do participants report lifestyle changes and medical compliance? Many of these evaluations will take place with one-on-one discussions between healthcare providers and program participants. Furthermore, patient evaluations will be collected to evaluate content comprehension. These evaluations will include the options for suggestions for improvement. The DNP may be able to identify areas of the program that patients aren't quite gaining knowledge from, or maybe could be changed so that patients will be of more benefit to the patients. Overview. Coronary artery disease is the leading cause of death in the United States. Lifestyle is a modifiable risk factor. The DNP will encourage program participants to change lifestyle factors that they can modify, such as smoking, sedentary lifestyles, poor dietary habits, and medical noncompliance. Efforts made to improve medical compliance may reduce the risk of heart attack. Heart attack prevention programs may increase compliance and reduce cardiac events in a patient population. References.